So we're going to continue with this acknowledgement of the importance of intersectionality and identity with regard to sexual violence with a talk from Dr. Christine Lindquist, a senior research sociologist at RTI International. Dr. Lindquist has played key roles on several federally funded surveys related to sexual misconduct on college campuses, including the Campus Climate Survey Validation Study, the Campus Sexual Assault Study, and the Historically Black Colleges and Universities Campus Sexual Assault Study. Dr. Lindquist will be speaking on sexual assault on historically black colleges and university campuses. What do we know, and how can we use this information to improve prevention efforts? So, welcome, Dr. Lindquist.
Good afternoon, everyone. I'm so excited to be a part of today's summit. Thank you so much for inviting me. I've enjoyed the day so much already. I'm Christine Lindquist, as Quinn said, from RTI International, which is a nonprofit research organization. I was invited to share what we have learned about sexual assault on HBCU campuses, primarily because I was involved in the largest study of campus sexual assault on HBCU campuses to date. So, this shows an overview of my presentation today. I'm going to summarize what we learned from the HBCU CSA study regarding the prevalence of victimization among HBCU students, what the risk factors look like, what the mental health consequences are, and then survivors' experiences with disclosure and reporting their experiences. And then I'm going to tie this all together in terms of what the research tells us that can be used to guide prevention efforts and survivor services. And I promise I will get through all these topics in 25 minutes, but you probably will see me skimming through some slides because I was overly ambitious when I was preparing the slides. I thought it was really important to start off with some context about the HBCU experience. Why is it important to understand sexual assault on HBCU campuses? And first, HBCUs are extremely influential in educating and graduating black students in this country. There are over 100 HBCUs that are currently operational in the United States, and although this reflects only about 3% of institutions of higher education, HBCUs actually graduate 20% of black college graduates and 75% of black PhDs in this country. So very influential, and also HBCUs don't just focus on educating individual students. Their reach extends far beyond the individual students they educate, because central to the mission of HBCUs is social change, social justice, community service, and citizenship and leadership. So they have a very wide-reaching reach beyond just the students that they educate. Secondly, some general population studies and some, but not all, college population studies have found higher rates of sexual assault and other forms of violence among black women. So certainly this is not a low-risk population that we're talking about when we think about HBCU students. And then third, and very importantly, there are some contextual and cultural factors at HBCUs that come into play when thinking about sexual assault. And these aren't necessarily factors that put HBCU students at greater risk of experiencing sexual assault. And indeed, as you'll see, we actually found lower rates of sexual assault among HBCU students in our study. And there may be protective factors such as lower prevalence of alcohol use frequency on HBCU campuses. But I think these factors are very influential when it comes to what happens after a sexual assault takes place, particularly when it comes to survivors' decision about whether to disclose their experiences or not. So first, there's a very strong sense of community among HBCU campuses. They are very close-knit, a very strong sense of family, strong emphasis on developing mentoring relationships, professional networking, very strong alumni associations. And while this undoubtedly has a lot of protective effects and many benefits for HBCU students, it may cause students who experience sexual assault to have very strong concerns about their privacy and confidentiality and protecting their reputation, and concerns that if they were to disclose their experiences, there might be a host of negative effects in terms of the relationships that they've developed. So that's something to keep in mind. And related to that is the history of injustice and criminalization of black men in this country. This may act to reinforce a culture of silence among survivors on HBCU campuses who may be reluctant to disclose their experiences out of a desire to avoid contributing further to the criminalization of black men. So this may mean that survivors may be more reluctant to disclose their experiences to law enforcement, and it may even keep them from seeking help that they need to recover from the assault as well. And the final contextual factors are things that I'm going to cover at the very end in terms of implications for survivor services. Most of what we know about sexual assault on HBCU campuses comes from our study, which was funded by the National Institute of Justice in 2007. We published the final report in 2010. It remains the largest study on this topic to date, although it's my understanding that there's a new HBCU study currently underway that I believe Rutgers University is leading, and this is funded by NIJ and CDC and the Office on Violence Against Women. So hopefully we'll have some updated information coming out of that study soon. Our study, which was done, as you can see, back in over 10 years ago now, included 4 diverse HBCUs in terms of both public and private schools. They were diverse in terms of geographic region and size. We collected data from nearly 4,000 undergraduate women across the schools. Importantly, because we wanted to be able to compare the HBCU data with our earlier campus sexual assault study data, we used methods and a survey instrument that were virtually identical to the earlier study, which was done at 2 large public universities with a sample of nearly 5,500 undergraduate women. So both studies involved anonymous web-based surveys. We provided incentives for participation. And I will say that we struggled with response rates in the HBCU study. We ended up with about 25% of students taking the survey compared to 42% in the original CSA study. We did an extensive non-response bias analysis, and we did weight the data to adjust for non-response bias. We used behaviorally specific questions to assess students' experiences with sexual assault. Of course, we would never use terms like sexual assault in a climate survey. And we measured both physically forced sexual assault and incapacitated sexual assault, which I know some of the sessions this morning talked about. And this is really relevant when looking at experiences among HBCU students because of the lower frequency of alcohol drinking. So incapacitated sexual assault is unwanted sexual contact that the student could not consent to or stop what was happening because of the effects of drugs or alcohol. We work closely with the participating schools, and this is really important for researcher partnerships with HBCUs. This is an example of a recruitment flyer that was developed by one of our partnering schools. We did adapt the survey a little bit, mainly in terms of the examples that were used based on student input. We included measures of intimate partner violence based on the school's request because administrators perceived that intimate partner violence was a big issue among their students, and they wanted to collect some data on this topic. And then we also included some open-ended questions at the end of the survey to get at student-initiated ideas about what could be done to increase reporting of sexual assault on campus. So those were some of the main differences between the HBCU study and the CSA study. So what did we learn from our research? First, I'm going to focus on the prevalence of victimization. And for each of these 4 areas, I've listed a source paper, which is a journal article that we published for each of the specific topics for those of you who are interested, because I am having to move really quickly. I'm going to start with what the key takeaways were first regarding prevalence of victimization. We found that about 10% of HBCU undergraduate women had experienced a completed sexual assault, either physically forced or incapacitated, since entering college. And this may be lower than other numbers you've seen, partly because this includes freshmen, sophomores, juniors, and seniors. And obviously, only seniors have had the full 4 years of experience. This rate was actually lower than the comparable estimate from the earlier CSA study. In that study, closer to 14% of undergraduate students had experienced a completed sexual assault within that same time frame. And as you'll see, further analyses show that this difference was associated with lower alcohol use frequency among black women, regardless of whether they attended an HBCU or not. And I'm not going to go into this because I'm going to show you the slides. Other than the fact that they occurred at lower levels, the types of sexual assaults experienced by HBCU students were generally similar in terms of context as what other campus climate surveys conducted at non-HBCUs have found. And then also based on our examination of the prevalence of intimate partner violence, it appeared that these rates were actually quite high, although we couldn't do direct comparisons with other studies. And I'll show you those findings in just a minute. I'm going to have to go pretty quickly here, but I did want to draw your attention to the since entering college estimates that are shown in the lower half. So you can see here what we have done is shown the proportion of HBCU undergraduate women who reported experiencing any sexual assault since entering college, and then we have it broken down by type. And then we, to the right, we show the same prevalence estimates for the earlier CSA study, which was done at 2 large public universities. And differences that are orange show statistically significant differences between the 2 study samples. And as I mentioned, the rate of any sexual assault was significantly lower in the HBCU study than it was in the CSA study. And when you look at the type of sexual assaults that happened, the 2 groups had comparable levels of physically forced sexual assault, and where we really saw the difference was with regard to incapacitated sexual assault. So we wondered if this was due to factors unique to the HBCU context, or if it had more to do with the racial and ethnic composition of our samples, because our HBCU study was 87% black women, and the CSA study was only 16% black women. So I'm going to skip a couple of the other bivariate findings and go straight to this multivariate model where we entered different independent variables in stages to isolate the effect of different factors. So for this analysis, we combined the HBCU data with the CSA data, and we subset only to undergraduate women who were between the ages of 18 and 25 because we wanted to have some comparability in the samples. And we reduced the sample to only women who were attending school at least half-time. And what we found in the first stage, where we just had school type, is that, as we saw with the bivariate findings, HBCU students had a lower probability of experiencing sexual assault since entering college. But then in the second stage of the model, we entered a dummy variable for race. And you can see here that HBCU status is no longer significant, but race was, meaning that black women had significantly lower rates of any sexual assault than white women. But then in the third stage, this is where the findings get really interesting, because here we added measures of students' alcohol use consumption. And you can see here that all of the alcohol use indicators are highly significantly associated with increased odds of sexual assault, and that once we enter those variables in the models, we actually no longer have significant differences by school type or by race. And this tells us that what we were seeing earlier in terms of lower prevalence of sexual assault for HBCU students was actually due to lower alcohol frequency among black women, regardless of the type of school they attended. When we subset to black women only in the 2 samples, we didn't see any differences between those who attended an HBCU or those who attended a large public university. And those the significant effects of alcohol use are evident even when we controlled for prior victimization, which is, of course, a significant risk factor, and then age. Okay, so moving, and just a note about the context of sexual assault. When we looked at who the perpetrators were, where the sexual assaults happened, in general, we found a very similar pattern to other campus sexual assault studies. Most of the students knew the person who assaulted them either well or very well. They were typically classmates or students or dating partners or friends. Nearly all the assailants were men, and 91% were of the same race as the victim, according to victim report. Most of the sexual assaults in the HBCU sample occurred off campus, typically in someone else's living quarters, and they tended to happen late at night, on the weekends, and during the fall and winter months. The last thing I wanted to say about prevalence is that, as I mentioned, we also looked at intimate partner violence. And this shows the proportion of the HBCU women who reported experiencing each type of intimate partner violence within the past year. So unlike sexual assault, which was since entering college, this is actually a past year estimate for IPV. And we found that overall about 2/3 of our sample had experienced at least one type of IPV within the past year, and 18% had experienced physically some type of physical victimization by an intimate partner, which seemed fairly high to us, but as I mentioned, we don't have a direct comparison that we're able to make with another data set. But I think this is something relevant to keep in mind for prevention efforts. Okay, I'm just going to very briefly summarize what we found regarding risk factors for victimization in the HBCU study. This is very consistent with what you heard this morning from Dr. Testa, with what the previous studies have shown. We found that HBCU women were at greater risk of experiencing sexual assault. Those who were at greatest risk were more likely to be attracted to both men and women, and this is certainly similar to what we've seen in several large studies not conducted at HBCUs. Sorority membership was a risk factor among our sample. Attending fraternity parties, dating experiences, consensual sexual activity. These were all risk factors, as well as binge drinking, and then, of course, prior victimization was a major risk factor. And what was interesting here is that there was some specificity in the type of sexual assault that we're talking about. So students who had experienced physically forced victimization before entering college were more likely to experience that type of victimization, but not necessarily incapacitated sexual assault after entering college. And the same thing was true for incapacitated sexual assault. So definitely some degree of specificity when it comes to prior victimization being a risk factor. I'm going to skip over this odd caveat. In terms of consequences, we can't really say a lot here because our study was cross-sectional, but we did look at mental health status, and we compared survivors of sexual assault with students who had not experienced victimization. And we found that women who experienced sexual assault of either type had significantly higher levels of current depression, as well as post-traumatic stress disorder symptoms. So we found that about half of survivors of sexual assault since entering college screened positive for current PTSD as of the time of the survey, compared to only about a quarter of women who hadn't been assaulted. And same thing for depression, higher depression scores for survivors compared to non-victims. And we found these worse mental health outcomes even when controlling for covariates such as prior victimization or physical health or intimate partner violence. I think I'm going to skip over sustaining injuries. And I want to end the research summary by talking about what we learned regarding disclosure and reporting, because I think this is where we have a lot of implications for improvements that I think need to happen on HBCU campuses. And I'm going to skip the takeaways and go right to the data. We found, as other studies have found, that the majority of students did tell someone close to them about the assault. I think nearly every study I've seen has found that about 2/3 of students tell either a friend or family member about what happened to them. You can see the proportion is a little higher when you're talking about physically forced sexual assault than it is for incapacitated sexual assault. But very few survivors contacted a victim's crisis or healthcare facility, and even fewer reported to a law enforcement agency. As you can see here from comparing the blue and the orange bars, seeking formal support or reporting to a formal source was more common for victims of physically forced sexual assault than for victims of incapacitated sexual assault. And as we've talked about throughout the day, HBCUs, just like any other campus, certainly cannot rely on official student reports to get any sense of the magnitude of the problem on their campuses, given extremely low levels of reporting. We asked some follow-up questions for students who did seek formal supports after the incident, including those who sought help from a victim's crisis or healthcare center. And among the small number of students who did seek out this type of support, we found that, interestingly, the majority actually sought help off campus, so from a provider not affiliated with the university. Most survivors who did this were satisfied with the way it was handled, especially those who sought off-campus services. But about 27 to 31% of survivors did regret their decision to report to a victims assistance type agency. And these numbers are much higher when we look at what happened with those who disclosed to a law enforcement agency. So among the even smaller number of students who reported to a law enforcement agency, and even though our study included almost 4,000 women, we're talking single-digit numbers here because so few women ended up reporting their experiences to a law enforcement agency. Women were equally likely to contact campus police and community police. And rates of satisfaction were lower than what we saw for victims assistance type providers, so only 39 to 43% of survivors were satisfied with how it was handling, and 36% of physically forced victims and 69% of incapacitated victims regretted their decision to report. And I think this is really a really important takeaway for service providers to be aware of, is that for many students, they did not have a good experience when they did come forward. The reasons for not reporting are pretty similar to what we see in the literature, and I have to say that we use sort of a standard set of close-ended responses for not reporting. I wish we had added more culturally specific reasons for not reporting, given some of those barriers that I discussed. But based on what we found, the most common reasons for not reporting, when you look at both types of formal supports, were similar to what the AAU study and other studies have found. Students felt that it wasn't serious enough to report, and students did not want anyone to know about it. So these are among the most common reasons that survivors indicated for not reporting their experiences. I mentioned in our survey we also included some open-ended questions in an attempt to get more in-depth data from students about their ideas of what could be done to improve reporting, increase the odds of survivors coming forward on HBCU campuses. And we got some really insightful responses from students, many of whom took the time to actually write a lot of detail for us. So the most common, we coded the responses that were provided by students into themes, and the most common theme was that more education and awareness raising efforts about sexual assault and the services that were available would be important in increasing reporting of sexual assault. And this is illustrated by a quote that a student provided that really indicated that students need to know what's going to happen ahead of time before an incident even happens, because it's hard to process that information once it does happen. I think that if women knew the resources available to them before a situation occurs, they might be more inclined to go. After a traumatic event, someone might not want to put the energy in finding somewhere to go to seek help. Also, they might want to know about the process before going. So definitely making sure students know what's in store for them ahead of time was felt to be important. Second, most commonly, students provided answers provided suggestions that had to do with offering more services for survivors and more accessible reporting opportunities, such as having discrete locations off campus, making it really easy for students to report. Maintaining the confidentiality and privacy of survivors was described by a number of students who, again, articulated that the rumor mill on HBCU campuses is rampant and that survivors may be very reluctant to go forward and risk harm to their reputation and risk everyone knowing about what happened to them. Also, providing protection and security to survivors was a strategy, a student-led strategy for improving the likelihood of reporting. And then finally, ensuring that outcomes will be positive for survivors. So ensuring that they get the resources they need and that perpetrators are actually held accountable. Okay, so what does all this mean in terms of prevention and survivor response on HBCU campuses? First, here, when thinking about prevention programs, yes, what we found is that the risk factors for HBCU students look very much like what we see on non-HBCU campuses. And the context in which sexual assault happens appears to be the same. Given the lower frequency of alcohol consumption, incapacitated sexual assault may happen less commonly, but most sexual assaults still happen in the context of drinking and students drinking heavily. So it's not necessarily that the content of prevention programs need to be different for HBCU campuses than what we see elsewhere, but I think messages need to be tailored to specific audiences to be as effective as possible. And there have been efforts to mobilize men of color as allies that have been developed and I think should be promoted on HBCU campuses, so changing norms and attitudinal focused programs that are specific to men of color, I think is critical for prevention of perpetration. And also some bystander intervention programs have been developed in partnership with HBCUs and are specifically designed for students of culture and should be widespread on HBCU campuses. Also, given what we found regarding intimate partner violence among HBCU students, I think it's really important for prevention efforts to focus on healthy, safe dating and intimate relationship skills. I think that could be very important. And then many HBCUs are extremely financially strapped, especially public land-grant HBCUs. Their funding is under attack right now, and as a result, staff are serving multiple roles. You may not have dedicated prevention staff at many HBCUs. So I think definitely more resources for prevention staff are needed on HBCU campuses. Clearly, improvements in reporting mechanisms available to students are needed given very low rates of reporting and some of the barriers to reporting, as well as some of the student-initiated ideas. Expanding the role of peer support might be very productive on HBCU campuses, which really emphasize a culture of leadership and making the campus better for everyone. I think that really educating students about what to do when they disclose to you that they've experienced sexual assault would be productive. Perhaps student-led support groups as a precursor to formal reporting. I think these are some ideas that perhaps have promise. Definitely, given concerns about survivor confidentiality and privacy, improving procedures there to make students confident that it's not going to get around to everyone if they end up seeking help. But the students who do come forward and disclose their experiences need to have a good experience. They need to be glad they did. And what we found is that a lot of students regretted that decision, especially those who reported to law enforcement. So on the one hand, okay, I guess my time's up. I'm sorry, I did not see your previous warnings. So I definitely think improvements in survivor services are needed, echoing some of what Heather described about organizational readiness, making sure that staff are trained and able to provide culturally responsive care. And I'm happy to answer questions or field comments that you may have.
Hi. I graduated from HBCU, so I'm familiar with the ins and outs of how they operate. And you hit the nail on the head with the financial situation because a lot of us are strapped.
Yep.
And do you think these numbers are skewed a little bit because typically at a HBCU we don't have as many students as a PWI? Mm-hmm. When I graduated, we had about 5,000 to 6,000. It's more now. It's closer to 10, but even still, versus a school that has 20 or 30,000 students compared to 5 to 10, mm-hmm. Do you think those numbers are going to be off?
When you say the numbers might be skewed, do you mean the percentage of students
Yes.
who report? Yeah, I mean, we measure this in terms of of the survivors, you know, what percentage of them ended up reporting their experience. I guess it could be skewed if due to resource constraints, there are fewer opportunities for reporting and fewer mechanisms for reporting on HBCU campuses. It could be that students don't really know where to report and may not have somebody to report it to. I mean, that definitely could be going on with what we see with victims assistance type programs. I don't know that would explain low reporting among to campus police or law enforcement authorities.
Okay. So first, I just want to say thank you for doing this work and for sharing it with us. My question is, with the 4 HBCUs that you all did research with, were there prevention programs in place before?
Yes. Some of the HBCUs that we worked with had been OVW campus grantees and had some resources there. We really focused on conducting a climate survey, and I think Heather's point about perhaps maybe the need to do qualitative data collection as well might be relevant on HBCUs, because I think climate surveys may be more of a Eurocentric approach. But to get back to your question, we really approached this from the perspective that no research had been done to understand anything about victimization on HBCU campuses, so we really needed to focus on assessing prevalence and risk factors and consequences. We didn't do a detailed documentation of what types of services were available at these schools. We actually did try to do a campus police survey to understand like the types of training that they had received, but that didn't prove to be a very successful effort. So I can't really speak knowledgeably about what the 4 schools were doing in terms of prevention.
Over here. Hi. So it seems to me that one piece of this might be about a lack of resources or lack of knowledge about resources, but it seems like perhaps a just as big or bigger part of it might be that when students are accessing these resources, they are not getting what they need. And in fact, the high rates of regretting reporting to resources as well as the police are alarming. Do you have any thoughts about how to improve, and I see that this is on the slide that you didn't get to speak on, do you have any thoughts about improving the services that already exist?
Right. I mean, I think definitely some of the factors that Heather was talking about in terms of trauma-informed care, making sure that students are able to get services by women of color. I think service providers being knowledgeable about some of the contextual and cultural factors that come into play are really important. We saw those pretty dramatic mental health differences between survivors and non-victims, and that really speaks to the need for survivors to be able to get mental health care for themselves. But also, we want to see perpetrators held accountable. We want to see survivors reporting to campus police or officials that have the authority to investigate the incident and hold perpetrators accountable. So I definitely think more training and making sure that care is culturally responsive both on campus as well as off campus, given that many survivors ended up going off campus to get health care. And one other point I wanted to make that piggybacks onto Heather's talk is that it's been suggested that students with intersectional identities may have a hard time getting adequate care at HBCUs, so students who are gender and sexual minorities and students who identify with a religion other than Christianity, like, for example, Muslim students. It may be that more attention and awareness of staff as to how to meet the needs of those students is really needed.
I was wondering how diverse you studied 4 HBCUs, and HBCUs are a pretty diverse group of schools. You've got some pretty elite ones, and then you've got some that are pretty open policy, you know, anybody can get in, that kind of thing. How diverse were the 4 schools that you studied, and so how generalizable would your data be?
That is a really good question, and we're certainly not trying to argue that this would be generalizable to all HBCUs. We did select 4 that were diverse. We always keep the identity of the participating schools confidential, but I can tell you that we had one private school, we had other public schools, including a land-grant institution, definitely diverse in terms of size, different parts of the country, although primarily in the southeast. And we did see some differences in victimization rates. There was one school that had significantly higher rates than the other. So there definitely was some variability there. So I would say because of the variability that we saw just with 4 schools, I certainly wouldn't want anyone to get the idea that this really tells you what's going on with HBCUs everywhere. And hopefully the new study on HBCU campus sexual assault that's being done by Rutgers will include more schools, and we'll be able to answer some of those questions. Thanks.